And joining me now is Dr. Tom Frieden. He is the former director of the CDC and the president and CEO of Resolve to Save Lives. Tom, thanks for being here with us. Let's talk more about the vaccine. Science, the other day, I think it was yesterday, came out with an article that said, hey, listen, we got to talk about the vaccine side effects. There are side effects, and they can be serious side effects. And if we don't warn people about them, and here it is right here, you can read that. If we don't warn people about these side effects, there could be a real problem with misinformation when somebody starts to feel off and then warns people about the vaccine. So I take this to you, sir. What should we be telling folks?
Well, first off, what we've heard so far is really encouraging. In fact, it's surprisingly good news. I don't think any of us expected that we'd have vaccines that are 90% effective this quickly. But still, there's a lot we don't know. We don't know how long that immunity will last. We don't know whether there will be very rare but severe adverse events. And the key is to play it straight with people. Tell people exactly what we know and what we don't know. Katie, there's a really important meeting tomorrow afternoon. It's called the ACIP, the Advisory Committee on Immunization Practices. It may not be a household word, but that committee is the committee that decides which vaccines are given to everyone in the country and what the schedule is. And it's a really good group. They are the top vaccine experts from universities, from organizations that focus on vaccines. They look at the science and they will make recommendations for who should get the vaccine, when, in what order. And that's really important because we have to follow the science here. But as you say, be very open and honest. We haven't seen the full data from the companies. But what we've heard is, particularly after the second injection, people feel pretty sore. It hurts. They may feel under the weather for a while. And we need to be open and honest with that, or when rumors start flying around, it may be one step forward, two steps back.
Yeah, and let me just read some of the reported side effects. Fever, bone and muscle aches, and swelling. One subject reported that his arm looked like a goose egg, and the fever can get pretty high, 102 to 104 degrees. So, you know, it's some of the known symptoms of COVID-19, high fevers, aches and pains. Putting the side effects aside, Dr. Michael Osterholm, as you heard, was warning folks that we're just not being clear enough with the public about the safety of this, the whole process of this. In terms of getting the vaccine to hospitals, to drugstores, wherever they are going to be distributed, what can we tell people right now about the logistical process to make them feel a little bit better? I know there are a lot of folks that are concerned that this Pfizer vaccine is so cold that they're basically going to be injecting frozen liquid into their arms. There's a lot of misinformation and misunderstanding about that. Can you clear it up?
Well, first off, one way of conceptualizing that kind of reaction, the soreness, the fever, is that it's a vaccine take. It's basically an indication that your body is getting the message, the immune message, and will be prepared if you face the virus to fight it. The Pfizer vaccine is particularly challenging, not because of how cold it is when it's injected, but how cold it is when it's stored, as you've shown, at ultra low temperatures. And that makes it challenging. And so far, the company has said they're going to have these in boxes of about 1,000 or 5,000, have to be used within 5 to 15 days. And that suggests that the Pfizer vaccine, when it's warmed up and used, is going to have to be used either in large facilities with lots of patients or potentially in large vaccine clinics. One of the things that we'll want to look at carefully is making sure that all nursing home residents and staff have early access to the vaccine. Katie, about 40% of all of the deaths from COVID in the U.S. have been among nursing home residents. And about a third of nursing home residents turn over each month with admissions and discharges. So it's really important that every nursing home gets vaccination up and running soon. If we could get 2 doses of vaccine into most nursing home residents and staff by the end of January, that would save thousands of lives.
In terms of folks that were traveling over the weekend, what's the recommended quarantine time now? And I hate to keep referring to Dr. Osterholm, but I saw him so many times today, and he kept saying this that I want to ask you, with your knowledge, is 7 days enough? Is 10 days enough?
The average incubation period ranges from 2 days to 14 days. The peak is 5 or 6 days. Basically, in an ideal world, you would quarantine for about a week to 10 days and get a test before the end of quarantine. And if that were negative, you'd have a pretty high degree of confidence, though good idea to continue being careful, following protocols, wearing a mask after. But Katie, the issue is even bigger than that. We're really excited about this vaccine news, but vaccines are months away from being widely available for everyone. So on the one hand, we're going to see this appropriate, real push to get healthcare workers, nursing home, other people quickly vaccinated starting in a few weeks. On the other hand, it's going to be a few months or more before there's enough vaccine out there that we can begin relaxing those protocols. And that means that we have to double down on the things that we're so tired of doing. We have to wear masks, keep distance, avoid crowded indoor spaces, and wash hands, because that's going to keep deaths down and allow us to try to reopen more of the economy until the vaccine comes along somewhere around the middle of 2021.
The president's coronavirus vaccine czar, Moncef Slaoui, said we could get to essentially herd immunity by May, that enough people will be vaccinated by May, that we could go back to something resembling normal. Do you think that that's a timeline that we should hang our hats on? It's very optimistic.
It's optimistic. I hope it'll be the case, but really, time will tell. A lot can go wrong in vaccine programs, ranging from production to safety signals to reluctance to take the vaccine. So the key is to understand that this isn't like a grocery delivery service of getting very cold stuff delivered in time. This is a public health vaccination program. That means sharing information, listening to communities, hearing the concerns they have, educating healthcare workers, identifying vaccine sites. And that work is going on, but it needs to be done very well. It needs to reach into communities that may be reluctant to take vaccination. It needs to reach into communities that have been particularly hard hit, like Black and Latinx communities throughout the U.S. that have a much higher rate of hospitalization and death from COVID.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.